And we are taking your questions now for veterinarian Allan Berger. If you have a question, give us a call on Newsline 9. That number is 319-365-9999. And as we wait for our first caller to call in, we want to introduce you to Lillian.
Lillian's about 6 months old, and she was in the wrong place at the wrong time. She needs a home. Her owner was out of town for a few weeks, and she was staying with a friend. And the friend came down with an MRSA, a bacterial infection that it's not clear where they got it from, and the owner was concerned that it might have come from Lillian. Now, we're testing Lillian, but the owners can't afford the testing, can't afford the boarding, don't want to accept the risk that she might have been the cause. So, as I said, I'm paying for the testing. I don't want to put her to sleep, even though that was the original plan. She needs a home. She's, as far as we know, perfectly healthy. She does need to be spayed. We can take care of that. So if you're willing to take a 6-month-old cat, she's great.
And she's adorable.
Yeah. And she's healthy. It's just she was just in the wrong place at the wrong time with the MRSA infection.
Sure. And if you're interested in adopting her, who should they call?
Bright Eyes and Bushy Tails Vet Hospital in Iowa City.
Okay. And Carol's on the line now with a question. Go ahead, Carol.
Yes, we have a terrier, and when I took her in to have her bathed and trim, the groomer said she had a hot spot on her hip. Can you tell me what causes that and how I might treat it, please?
Yeah. So a hot spot is a skin infection. There's usually some sort of an underlying cause. Now, whether that's an allergy or that the dog incessantly licks at that spot and has damaged the skin and you get a bacterial infection secondary to that. There are times that it's a primary infection. The treatment a lot of times depends on how long it's been there. The longer the hot spot's been there, the harder it is to get rid of, just because you get into this vicious cycle of the dog licks at it, it gets wet, the infection gets worse, the dog licks at it more. It's usually something that requires going to a veterinarian. What you could do is to shave the hair so that it dries out. Stop the dog from licking at it, and sort of one step at a time, see if you can get it to go away. A lot of times I'll do antibiotics. Often I'll do steroids to try and just get some of the swelling down, and it's a bit of a process because it usually takes a while to form.
Dogs are stubborn. How would you suggest to get them to stop licking a spot like that?
Yeah, the first thing that you have to do is get it to dry out and try and get the itch gone. Usually, though, it takes an Elizabethan collar, a plastic cone over the head, once the dog is used to licking at it.
Oh, they love those.
Yeah, it's usually a bit of a process.
Well, again, you're putting Lillian through some testing to make sure she's perfectly healthy, but she seems to be, so if you're willing to give this 6-month-old kitten a home, give Bright Eyes and Bushy Tails a call. And veterinarian Allan Berger, thanks so much for coming in today. And coming up tomorrow, we're going to be talking with a financial expert about getting your taxes ready. Something we always have to do before April rolls around. And stay with your 24-hour news source, KCRG TV 9.